Health right now, where the Ministry of Health is set to lead Kenyans in a mass registration exercise for the Social Health Insurance Fund across all the 47 counties. Now, this is in line with the transition from NHIF to SHIF. That is the Social Health Insurance Fund, the new health scheme that comes into effect 1st July 2024, where you'll be expected to contribute 2.75% of your gross salary to the fund that aims to provide holistic healthcare for all Kenyans by expanding coverage and reducing costs. Now, with July just around the corner, we want to briefly interrogate the latest developments arising from that transition from NHIF to SHIF. And I'm now joined by Dr. Timothy Olweni, who's the chairperson of the Social Health Authority, for more details on this all-important transition that touches on the healthcare system in the country. Karibu sana, Daktari.
Thank you very much.
Thank you for your indulgence.
Yes, thanks for inviting me.
I think the best point to start would be the pending registration exercise that is set to be led by the Ministry of Health. When exactly can we expect that to start, and what will be the requirements expected from Kenyans as they turn up to register for this all-important fund?
Okay, first, I think even before I start, I want to correct the aspect of saying transition from NHIF to SHIF.
Yes.
It is not NHIF to SHIF. It is NHIF as a body to Social Health Authority as a body. There are three different funds under this body. There's a primary healthcare fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. So it is NHIF to those three funds.
Noted.
Or NHIF to the Social Health Authority.
Noted. Well
Good.
noted.
Yes.
Okay. So let's talk about the registration process. Yes.
Well, the registration process, as you are fully aware, I'm sure, we were supposed to commence on the 21st. And the Cabinet Secretary for Health and even Cabinet pronounced themselves on that date. However, you know that the enormity of the task ahead of us dictates that we pay meticulous attention to detail. And I would have preferred to be able to do it right and do it on time. But in the event I'm forced to choose between one of the two, we will do it right. So I want to assure people that despite the fact that we're behind schedule, given the complexity of the project and the multiple teams, there's a lot of teams that are working behind the scenes, doing a lot of work, and I'd like to appreciate all the work that they're doing. However, we're running behind schedule. Okay. There are certain field tests that we did in terms of registration. We had a visit to Marsabit because it became important that we don't just test within Nairobi and within a setting in an office or in a boardroom. We went out to the field. There's certain feedback which we got from there, which is now being worked on. We got another field test tomorrow we're going to do in Kajiado. And based on that kind of response, we want to make sure that we go to registration at a point when we are sure that it's going to be seamless. Because you have to remember that registration is just the beginning, but when we start delivering service as well, we're going to start delivering service if it's the 1st of July, if we manage to do it on time. But the key thing is we want to assure people that there's no emergency about it. Service has been continuing under NHIF. If it becomes necessary, that is extended slightly, it'll happen. The key thing is nobody should be denied service on the 1st of July on account of not registering or on account of any of the systems not being ready.
Okay, so the process is ongoing in terms of preparing for the registration process. But in terms of the deductions, they will start 1st July. That is in law, of course, yeah?
Well, the deductions would only start at the new rate if we're delivering the new benefits package. We can't start deductions in the Social Health Insurance Fund and deliver a package that is based on NHIF. So we are going to ensure that the deductions are also going to start at the time the new benefits package is rolled out. That's what the law says.
And I understand that this registration process will be held hand in hand with means testing.
Yes.
Kindly talk to us about this, because it plays a very key component in terms of determining which households can contribute, have that capacity to contribute, and those which can't. So talk to us about that.
Well, means testing came up. The genesis of means testing is because it was realized that the bulk of the funds that were being contributed in NHIF were predominantly coming from those who are on payroll. And that is not by accident, really, because NHIF was originally, when it was conceptualized and when it was commenced, it was actually designed for those in formal employment. However, over time, we have tried to onboard those people in the informal sector because, you know, as you try to push towards universal health coverage, any social health insurance scheme has to get everybody. That's how you get a significant pool. However, it became clear that those who are not in formal employment were not carrying their weight in terms of, it didn't matter what your means were, everybody was paying 500 shillings. That is inequitable to the extent that if you have somebody who earns 5,000 and they contribute 500 shillings, that's 10% of their monthly income. Somebody else earning $1 million, for example, would also contribute 500. So the idea behind that is to be able to let people contribute to the extent that they can and that they should. So then the question came, how do we assess people's income? That's where the means testing instrument comes in. It's also one of the things that is being refined based on the field testing we've done.
Okay.
We want a tool that can estimate your income based on some self-declaration. Of course, it is dependent on the goodwill of the person who is doing the self-declaration. However, it is the best tool we have at the moment. We want to refine it, and for me, especially as chair, as long as we are not unfair to anyone. In fact, if at the moment it might even underestimate your income slightly. But of course, we also don't want to be unfair to everybody and estimate their income above what their means are. So that's the idea behind means testing.
Okay, interesting. So it'll be rolled out as registration is done.
Yes,
as well,
ideally, as you register, if you're in formal employment, then
Okay.
there's no means testing because yours is based on payroll, it's 2.75% of your gross income as declared by your employer. However, if you're somebody who is not formally employed, or I'll use the term, whom your income doesn't come from salaried employment, then we estimate 2.75% of that. As for the law, you're supposed to pay an annual premium.
Okay.
And based on that, you'll be informed that this is the premium you need to pay. So ideally, you should pay it at the time of registration, but by no means later than the commencement of the scheme.
Interesting. Let's talk about the youth bulge in the country and how exactly they'll be catered for, because we have a